walks of life, their needs, remembering that one size does not fit all, but each voice is counted, each voice is represented, and that we look beyond the barriers and ask that we remove stumbling blocks to keep the focus on why we do what we do to make this a better world, a better place, a better county. I ask that you just lift up each and every one, touching them from the top of their heads to the soles of their feet, to walk in a light that guides them with strength and empowers them to look beyond what people bring up in reality. So we together, we come together as one body, celebrating who we are and whose we are. In the name of Jesus, amen.
Thank you, Pastor. Very inspirational word for today. We appreciate you for coming and being with us. Madam Clerk, next item, please.
Reading, correcting, and approval of the journal.
Vice Chair Palomero.
Move approval.
Support.
Moved and supported. Any discussion or corrections to the journal? Hearing none, please vote. What's not working, Joe? Live stream's not working?
Motion carries.
Thank you. And for the record, the live stream was just recorded that they're working on getting the Zoom together. Next item.
Report from the chair.
Thank you. A couple of reports. First, I'd like to call Mr. John Wallace to the podium. He has a few words for us.
Good morning, Chair Bell, commissioners and commission staff. Thanks for allowing me to come down and just give a quick statement with regard to the budget. Thank you for your continued patience with the budget process this year. We do recognize that we missed a couple of our own deadlines with the budget process this year. And we do recognize that this has cut into your time to do your all-important work to review and analyze this budget. And for that, I take full responsibility. We submitted this budget last Saturday, August 16th, which is about 8 or 9 days later than the prior year. However, despite the timing of this budget, we think that you all will be very proud of this budget and the investments and the initiatives and priorities that are contained in this budget. Over the past year, I've been working on a strategy to improve upon the budget process for Wayne County. And in fact, our new budget director over here, Mr. Whitfield, started this past Monday, which was confirmed by this body two committees ago. So I just want to thank the commission and commission staff for your continued commitment to this budget process. My team will make ourselves fully available to answer any and all questions regarding this proposed budget as we move forward. I'm looking forward to the hearings. And also, from just lessons learned, we're going to, continue to learn upon this experience and make better improvements for next year. Thank you.
Thank you, Mr. Wallace. Unfortunately, as you know, it was later than we wanted it to be and later than you wanted it to be as well. But we are going to do our due diligence as we always do through our fiscal team to make sure that we are analyzing it and that we're being prepared for the budget hearings. To the commissioners, there will be not an abbreviated schedule, but there'll be more meetings on days that we typically don't have meetings, Mondays, Fridays, to make sure that we do our work to analyze and to present a budget to this body. We will have a vote on the budget right up to the end. So right now, our proposed budget meeting will be Monday, September 29th. As you know, we have to have the budget done before our budget begins, which is October 1. So we will have our final meeting as it's proposed right now on September 29th, but the budget hearings will take place throughout the month of September. So thank you, Mr. Wallace, for coming with us today, and we look forward to the budget report, which will be September 4th. Is that correct, Terrence? September 4th, which will have the CFO reading the budget, and our Auditor General will have the her response to the technical items on that as well. All right. Thank you so much. One of the last meetings I mentioned about having commissioners that serve on the various boards to come and give a couple of minutes update on one of the committees that they serve on. I'm going to ask that Commissioner Clemente speak to the Art Authority and something special that we have on some of the floors throughout the Guardian Building. Commissioner Clemente?
Thank you, Madam Chair. Yes, so we have high school art that is on the promenade and other floors in the Guardian Building. This is a collection that was created by students in grades 9 through 12 throughout Wayne County. And in the art show that was at the Detroit Institute for Art, there were 80 pieces that included paintings, prints, drawings, photography, ceramics, jewelry, and more. And then the students were asked if they wanted their art to be displayed further. So we will be having these pieces throughout the Guardian Promenade and other floors in the Guardian Building until the end of August. And just want to remind everybody that the millage that Wayne, Oakland, and Macomb County allows everyone to go to the DIA and see all the exhibits. There's a lot of wonderful things going on. Coming up, there will be ofrendas that will be throughout the museum for Hispanic Heritage Month. So it's a great place to go and enjoy and take your family. There's all kinds of different movies and craft projects for students. So make sure we take advantage of this wonderful treasure that we have. So thank you.
Thank you, Commissioner. And on the 7th floor by the elevators and in the reception area, you will see the wonderful works of art by our students throughout Wayne County. So make sure that you just stop and look at it and take it all in. We're so proud of the students that we have throughout the county for the amazing artwork and to display it here is amazing as well. So thank you, Commissioner, for that update. And when we have our next full board meeting, I'll call on someone else. We don't know who, but someone else. All right. Thank you so much. Next item, please.
We're on page 2 of the agenda, unfinished business. There is one item listed, ratification of the chair's exigent approval of a 5-year sole source software as an annual service agreement between the Charter County of Wayne and Bottom Line Technologies.
Hey, there's someone to speak on this, please. It was passed for the day at the last meeting because the administration wasn't prepared for it to move forward. Could someone speak to this today?
Stafford, a Director of Special Projects, Wayne County Treasurer's Office. This contract is to replace the existing C-Series check printing platform that has been in use for over 25 years. The software is now obsolete, and it'll be replaced by a cloud-based platform that we are working to get implement as soon as possible. So it's just a ratification of the exigent approval.
Any questions to this item? Commissioner Garza?
Thank you, Madam Chair. I just had a question as to the timeline for that to come online. Do you have a timeline on that?
We expect to get this online within the next 60 days.
Thank you, Madam Chair.
Thank you. Any additional questions? Okay, thank you, sir. Been moved by Commissioner Clemente, supported by Commissioner Garza. One more time for questions on this particular item. Hearing none, please vote. Yes.
Motion carries.
Thank you so much. Next item, please.
We're on offering of all petitions, ordinances, resolutions, and presentations. There are none listed. We're moving to reports from committees. Report A is from the Committee on Public Services. There are 23 items listed on pages 2 through 10 of the agenda.
Thank you, Commissioner Marecki.
Thank you, Madam Chair. I'd like to move items 1 through 23 for approval and make Commissioner Garza the maker of the motion on number 11.
Duly noted.
All right, thank you, Commissioner Kenizik.
Thank you, Madam Chair. With the permission of the committee chair, I'd love to be the maker of the motion on item 12.
Sure.
Vice Chair Pro Tem Baydun.
Maraki, item 15, please.
Commissioner Clemente.
I could be the maker of number 2 through the chair.
Number 2. Okay. Commissioner Garza.
Thank you, Madam Chair. I'd like to abstain on item number 5.
Duly noted. Any discussion on the items on the Public Services Report? And for those of you who are new to the full board meeting, we work in committees on the Wayne County Commission, and the items that are listed here on the agenda have been vetted at the committee process, and they come here for final disposition. Any final discussion on the items under the Public Services Report? All right, hearing none, please vote.
Motion carries. I have Commissioner Garza as the maker of the motion on item number 11 and an abstention on item number 5. Commissioner Kenizik, maker of the motion 12. Commissioner Baydun, 15. Commissioner Clemente, number 2.
Thank you. Next item, please.
We are on report B from the Committee on Ways and Means. There are 3 items listed.
Commissioner Kinlock.
Madam Chair, I move approval of the entire report. There are 3 items. Support.
Moved by Commissioner Kinlock, supported by Vice Chair Pro Tem Baydun. Any discussion on the 3 items listed on the Committee on Ways and Means? Any discussion? Any discussion? Hearing none, please vote.
Motion carries.
Thank you. Next item, please.
We're on report C from the Committee on Health and Human Services. There are 7 items listed on pages 10 through 13 of the agenda.
Commissioner Scott.
Thank you, Madam Chair. I'd like to receive and file items 1, 2, and 3, and a motion for 4 through 7 to be approved.
Moved by Commissioner Scott, supported by Commissioner Marecki. Discussion, Commissioner Killeen.
Thank you, Madam Chair. And I'd like to call members' attention to item 1, the report from the MEO's office. Looking around the room here, some of you commissioners will remember before 3-4 years ago, before Wayne State University was hired to manage the MEO's office, that our offices were getting calls because they couldn't get cremation permits from the MEO office in order to cremate, and it went on for a long time, and it was a long battle. I know I talked to a lot of funeral homes back in those days, but I just want to call attention to that report because now with the MEO's office, they are sending the certificates out to the to the funeral homes, and I think the turnaround time now is less than a half hour. And consequently, funeral homes have fallen way behind on paying that bill. There's a lot of accounts receivables out there now, but that service, because that was really for families that had to wait a week or 2 weeks to get their relatives released from the funeral home, caused enormous consternation with those families. So I just want to call people's attention to that report.
Thank you.
Thank you.
As a matter of fact, I'm going to ask Director Johnson if she is here. Interim Director Johnson and her team to come and speak to items 1, 2, and 3 because the information that was shared at the Health and Human Services Committee is something that I think all commissioners should hear about. I know you can read it in your packet, but I'd like them to give a synopsis of those reports at this time. Director Johnson.
Good morning, Chair Bell, Commissioners, and Commission staff. My name is Keneal Johnson. I'm the Interim Director of the Department of Health, Human and Veteran Services. And I want to thank you for the opportunity to provide you a brief update on the Well Wayne Initiative led by the Department of Health, Human and Veteran Services. So as outlined in transmittal letter submitted to the Commission dated July 24th, this update fulfills the reporting requirements of Enrolled Ordinance 2024-664. It includes the status of key Well Wayne programs that have been launched, as well as an overview of our growing project pipeline. The Well Wayne Initiative is a comprehensive, community-focused effort to improve health outcomes across Wayne County by addressing both environmental and social determinants of health. Our guiding principles center on ensuring services are accessible, community-driven, collaborative, evidence-based, sustainable, and service-oriented. So here are a few highlights from the programs that we've launched over the last couple years. The first program focuses on the Air Quality Network. In partnership with Just Air, this initiative aims to enhance environmental health monitoring and public engagement through the deployment of real-time air quality sensors in targeted communities throughout Wayne County. Since launching the program in June of 2023, we've deployed 100 air quality monitors across 34 communities and 55 zip codes. Over half of the daily air quality index readings have been in good range. The worst air quality days that we've seen year over year typically have been around July, which is due to the fireworks from the 4th of July holiday. In recent days, I'm sure many of you may have heard about the air quality as a result of the wildfires in Canada. We have seen some poor air quality days related to that, but overall, over half of the days have been good air quality days. More than 10 community organizations are actively using the data to inform public health planning. And in addition to the station monitors, we are distributing 500 mobile monitors and inhaler trackers to high-risk residents throughout Wayne County. The next initiative that I'd like to highlight is the medical debt relief. This project focuses on reducing the burden of medical debt for low-income Wayne County residents by purchasing and forgiving eligible debts. In partnership with Undo, which was formerly known as RIP Medical, we've eliminated over $42 million in medical debt for more than 71,000 Wayne County residents since March of 2024. This is a powerful, cost-effective strategy to address economic barriers to health, and we're exploring additional partnerships with local healthcare systems to expand our reach. Finally, I'd like to highlight the Vision program. In collaboration with Vision to Learn that launched in October 2024, we provided vision screenings, exams, and glasses at 40 sites, including schools, as well as a juvenile detention facility. To date, over 13,000 screenings and 4,000 exams have been completed, with more than 3,700 children receiving prescription glasses. Dr. Schaaf will be providing an update on the Well Wayne initiative, so I won't go over that. But I do want to say, in addition to these active programs, our pipelines include innovative projects in various stages such as the RX Kids Initiative, Birth Center, Food Safety Enhancements, and Integrated Crisis Response. These efforts will be brought forward to the commission as they move through the design and development phase. And finally, I want to thank you all for your continued partnership and support in bringing these bold, equity-driven health solutions to life. We are committed to transparency, impact, and collaborative problem solving as we move this work forward. So thank you.
Thank you so much.
Mhm.
Any questions on the information that Interim Director Johnson just outlined? Commissioner Baker McCormick?
Thank you, Madam Chair. I agree these programs are impactful, and I appreciate the work that you have jumped in and really getting things where we need it to be. One of the questions I asked, just so commissioners will know, is the zip codes or the areas in which the medical debt relief has most impacted, just so we know the equity of it all. And I'm not sure if you have worked on that yet or have any information on where the $42 million has
Yes.
gone. Yeah.
Yes, we do have a report that's broken down by zip code, and I'd be happy to share it with the commissioners.
Okay, great. Thank you.
If you could send that to the Ms. Lane, and then she'll distribute it.
Absolutely.
Thank you, Madam Chair. And Director, would you mind, because over the medical debt, there's confusion about that. You know, in terms of, can you go over, because we don't get to pick and choose.
We
Okay,
don't.
so can you just go over what that process is? Are we dealing directly with hospitals? Are we dealing with debt that hospitals have passed along to collection firms? And then we pay those off in total, whoever is a part. So could you go over that process just a little bit so people understand it better? Thank you.
Yes, so we do partner, so Undo, they reach out to hospitals as well as third-party medical debt collectors. So hospitals oftentimes sell their debt to third parties for pennies on a dollar. And so Undo reaches out to those organizations and see if they're willing to sell their debt to Undo, again, for pennies on the dollar. So at the time Undo gets it, they may be purchasing $700 worth of debt for $7. And that's how we're able to buy so much debt at a low cost. We do not have, I know we've been asked, we've been contacted and said, we have somebody with some bills, can they send them in to be paid? And unfortunately, it doesn't work like that. It all depends on what organization the hospital sells their medical debt to, and if that organization is willing to work with Undo Medical.
And have any of the hospital systems participated in selling us their medical debt, or are we all going through third parties?
To my knowledge, none of the hospitals have participated, but at the same time, they also don't have to disclose that information if they're selling their debt. It's my understanding that everyone that we've worked with as of today has been a third party.
Thank you, and I think that's an important point because people may be under the impression that we are going out or they can come to us and we can do that. This is strictly Undo working with the third-party collection companies and buying their debt. And then you'll get the consumer will get a letter saying that your debt has been relieved.
Yes.
But that's between Undo and the third-party collection agency.
Yes.
Okay, thank you. Commissioner Marecki?
Thank you. And I'd just like to make a comment too, because the question was asked about seeing the zip codes, which is fine. I mean, that's just informational, but it's got nothing to do with us determining equity around the county. They're taking care of all that. Nobody applies for this.
Right.
You don't even have the names of the people that get the debt relieved. So,
No.
I mean, it'll just be informational about the zip code, but if my zip code doesn't have anybody in it, it doesn't mean I'm getting screwed in my county, in my district.
Exactly. It just means your debt was not part of the group that was sold to.
Right.
Yeah.
Thank you.
Commissioner Anderson?
Thank you, Madam Chair. I just wanted to ask Ms. Johnson, I understand that toxicology testing, when an autopsy is being done, is sent to Texas. Have we checked over the years, have we checked to see if there's someone closer than Texas?
I am not aware of, I don't have the answer to that, but I can look into that and let you know.
I'd appreciate it.
Yeah.
Thank you.
Mhm.
Commissioner Kinlock.
Yes, thank you. I know when Dr. Abdul Sayed had brought this program to the commission for during the budget hearings, we raised some questions as it relates to which pot of money would be utilized for the various programs. So my question to you is whether or not, and particularly we were talking about the use of the indigent funds and whether or not I'm asking whether or not any of the programs whether or not funds are being used from the indigent fund,
Well, I do.
especially the eyeglass program.
The eyeglass program, my understanding is that that is all the post-ARPA funds, not the indigent funds. I think that for the medical debt relief, we are using a portion of the funds, I think $2 million for the medical debt relief are coming from the indigent. But I can confirm that as well.
Okay, yes, we'd
Yes.
like to get more into that once we start having our budget hearings. Yeah.
Okay.
Thank you.
Thank you. Commissioner Baker McCormick.
Thank you, Madam Chair. Just to follow up on the medical debt, when we first looked at this contract and to assist Wayne County residents with debt relief, we thoroughly discussed the equity of it. And so that is important that we analyze that, because we want to know that we're looking to try to help all over Wayne County, not just certain pockets. So that was one thing that we thoroughly talked about. And I remember the CEO of the company saying, yes, we're working with hospitals in Detroit. We're looking to partner with various hospitals so that we can eliminate or try to help equally if they could. So that is the question that I was asking, because that's the discussion that was had.
Okay.
And I just wanted to give you some background because I know you weren't here at the time.
I appreciate that background, and I think
you.
once I share the report that's broken down by zip code, it'll show you the equitable distribution, and we can look further into it if we need to.
Mr. Kinlock, you have your hand raised?
Yes, thank you, Madam Chair. So the equity question, you did state that we do not have any role in determining who is part of the bundle of debt that's being taken care of.
Correct.
So the equity question is a very important question and concern in this county, in this commission, the county executive. Everyone is absolutely concerned about equity as it relates to fairness and opportunity within when it comes to the uses of our resources. But the equity question is not one that would, it's not something that we can control or something that is appropriate to be mentioned because it sort of confuses individuals who may or may not have heard of this program. So I just want to put it out there that equity is not something that we or even the companies can control based upon the folks who are part of that bundle of debt that's being handled. Thank you.
Thank you. Thank you, Ms. Johnson, for your report. That was good information, and that we'll continue to follow and get updates on that. And let me just note that with the medical debt portion, with Oakland County and Wayne County being the leaders in this, the state of Michigan is now doing a program. So I want to congratulate us for being the front runners and the leaders in this space, because now the governor is going to present that for a statewide initiative. Myself and the county executive was at an event where she rolled that out. So I'm grateful that Wayne County is a leader in providing this, and now that the state is going to take it up. And I'm also very happy about Just Air being a small minority business, is doing well with Wayne County provide this service to monitor the air quality throughout the county as well. So those are good news stories. So thank you so much. And I know you have another speaker, Dr. Chef.
Hi, Dr. Sheth, Chief Medical Officer and Division Director of Clinical Care Services at HHVS. I'm excited to provide some highlights of a report that was submitted to the Commission on the Well Wayne Stations Initiative. This, just to remind everyone, is an initiative to expand access and reach to life-saving supplies of overdose reversal medication naloxone and drug testing supplies throughout Wayne County. It was launched almost a year ago, September of 2024, and this report highlights the cumulative impacts since launching the initiative back almost a year ago. And we are really excited to report on the progress. This is a partnership with the Wayne State University Center for Behavioral Health and Justice. They're really the experts. We're grateful to have local experts right here in Wayne County in expanding access to these supplies throughout Wayne County. And they've been such a key partner in these efforts. To date, we have placed over 60 Well Wayne stations, which are either vending machines or these newsstand style devices across our Wayne County communities. This has reached over half of our 43 Wayne County municipalities, so about 31 of 43 municipalities do have a Well Wayne station, at least one within the municipality. And just to kind of highlight our priority for making sure access to these supplies are in communities that are most impacted by overdoses. Nearly 80% of these stations are placed in zip codes with our highest overdose rates in Wayne County. Since placement, we've distributed over 12,000 naloxone kits through these various stations and over 5,000 drug testing kits. So that just underlines the demand for these supplies and the need for these supplies in the community since we've launched this initiative. This initiative wouldn't be possible without the diverse host sites that we have out in the community. And we have everything from libraries to college campuses to municipal buildings to retail stores. This community has really stepped up to identify this as a local need and to be a leader in serving as a host site. We do support these host sites in everything to be able to support these stations. So our teams are out there regularly updating and stocking these stations and really taking the burden off these host sites that have stepped up to provide access to these supplies in the community. One initiative that I hope that you all are seeing out in the community is the public awareness campaign that we've layered on this initiative and that is running parallel to this. And so we are really prioritizing ensuring that, it's great to have these stations out in the community, but we have to make sure that the community is aware of them and be able to easily access these supplies. And so we have a End Overdose Wayne campaign that is running right now. Our landing website is endoverdosewayne.org that really provides a lot of resources, information. We have a community toolkit on there that has all of these materials in various different languages for community organizations to disseminate. And it provides easy access to where an individual can find these stations near them. And so we have right now social and digital and billboards running across Wayne County to just raise awareness of overdose prevention and really by doing so lifting some of the stigma that we know is such a barrier to care. We continue to move forward with our partners on this in our kind of year 2 of implementation and getting consistent feedback from our host sites and community residents on ways we can improve and improve rollout moving forward.
Thank you. And you mentioned the dashboard, correct? Where the
Yeah,
public
so
can
we
find
have-
information?
Right, so we have, on endoverdosewayne.org, we have right now a, kind of a Google map locator for all of the, stations that are out there, the addresses, whether they're 24/7, and what can be accessed in those, at that site. We are also working on a, dashboard that we will be embedding soon on the website, where it shows real time, how many stations are out there, how many supplies have been deployed. So everyone will have kind of access to that information.
Wonderful. Thank you for that report, and thank you for the information you supplied me. The National Association of Counties had a recent meeting on opioid with representatives throughout the country, and it was a friendly competition with me and Milwaukee County because they have a dashboard that's up about their opioid use. And I said, well, we need one of those in Wayne County. So I'm glad that we're working on that as well, because no need to recreate the wheel, but if we see best practices throughout the country, I'm sure we should implement those as well. So I'm glad that, and with the endoverdose.org, you said soon there'll be a tab on our Wayne County webpage to go directly to that to get all that information?
Yes, so we will embed the link to the endoverdosewayne.org from the county website, so can direct folks to that landing page.
Fantastic. Thank you so much. Any questions for Dr. Shah? Commissioner Dodd?
Thank you, Madam Chair. Not a question, but August 31st is Overdose Awareness Day, so it's a great opportunity for commissioners to get information out about the program to residents.
Thank you. And if those who are interested, that just reminded me, there's a walk on Belle Isle on the 31st as well that I'll be participating in as we talk about ending opioid overdoses throughout Wayne County. Thank you. Any additional comments, questions? Commissioner Peterson Mayberry.
Thank you. Through the chair, I know we spent a lot of time talking about this in committee, and there was a question that was raised about if we are partnering with the school districts. So I just wanted to see if there's been any follow-up from that as we get ready to go back to school, as we know that vulnerable population could also be impacted by this information.
Yeah, thank you for raising that. I think, we are definitely incorporating that in our follow-up and in reach out to our contacts in the school districts. So there have been some conversations already with certain school districts. And so I think stay tuned and hopefully we can make some progress in that space. Thank you.
Thank you so much. Thank you, commissioners, for indulging us. Thank you, Commissioner Scott, for indulging us on your report. I think the information that was shared again at the committee level was important, that all of the commissioners needed to hear that as well. So thank you for that. And we will be doing more deeper dives when we have reports that go to committee at the full board meeting, because again, I think it's important that all of us hear that information. That's been moved by Commissioner Scott and supported by Commissioner Marecki, the Health and Human Services report. Any additional discussion? Hearing none, please vote.
Motion carries.
Thank you. Next item, please.
We are on report D from the Committee on Seniors and Veteran Affairs. There are 2 items listed.
Commissioner Knezik.
Thank you, Madam Chair. I move approval of the full report.
Moved by Commissioner Knezik, supported by Commissioner Garza. Is there any discussion on the 2 items under the Seniors and Veteran Affairs report? Commissioner Kleen.
Thank you, Madam Chair. It's not on the 2 items, but I'd like to get an update on the food vouchers for veterans.
Is there someone
I
here?
found out about it through a news media report. So I'd like to know what the update is.
Sure.
Thank you.
Carolyn Nemo, Deputy Director of Health, Human and Veteran Services. So where we are with the food vouchers, we have distributed all of our vouchers. We had 2,000 vouchers, and we wanted to ensure that before the end of this year, it reached our veterans. Last year, we had 750 vouchers that we were able to distribute, we doubled that amount, actually 60% increased it. And there was a high demand for the vouchers. I mean, word of mouth was excellent. And so we have distributed all of our vouchers and looking to see if there's funding that we can purchase for those who have raised concerns about it.
No additional vouchers in the immediate future to meet the need.
No, not right now.
And Madam Chair, I think that just highlights again the location of the Veterans Office. People coming downtown, spending their big dollars in, low-cost downtown parking to go and get their vouchers over there. And I know we've talked about this before, but I think this is an excellent example why we should be looking at locations where it's easier for our veterans to get to the Veterans Office and receive their services. Very high cost to have people come downtown. I'm just going to leave that as a comment. Thank you, Madam Chair.
I do want to mention, take the liberty to mention too, that we have been really looking at that. We have our Garden City location that we make, that veterans go and get their services. And in the next fiscal year, we will be launching our mobile unit that will go into the communities to meet veterans where they are. So we are actively trying to resolve that issue.
Great, because access, of course, is very important, especially for veterans and those who may be disabled. So the mobile unit will be an excellent resource on how they can access those services. Look forward to hearing more about that during budget hearings.
Thank you.
Any additional questions on the Seniors and Veterans Affairs report? Hearing none, please vote.
Motion carries.
Thank you. Next item,
We are on report E from the Committee on Audit. There are 3 items listed.
Commissioner Dobb.
Thank you, Madam Chair. I'd like to move items 1 and 2 for approval and item 3 for receive and file.
Okay, moved by Commissioner Dobbs, supported by Commissioner Peterson Mayberry. Any discussion on the items on the audit report? Discussion on the audit report. Hearing none. Please vote. Please vote.
Motion carries.
All right, next item, please.
We are on report F from the Committee on Public Safety, Judiciary, and Homeland Security. There are 4 items listed on pages 15 and 16 of the agenda.
Commissioner Garza.
Thank you, Madam Chair. I'd like to move item number 1 for receive and file and move approval of items 2, 3, and 4.
Moved by Commissioner Garza, supported by Commissioner Peterson Mayberry. Any discussion on the public safety report? Any discussion on the public safety report? Okay, hearing none, please vote.
Motion carries.
Thank you. All right, next item, please.
We're on report G from the Committee on Government Operations. There are 13 items listed on pages 16 through 19 of the agenda.
Commissioner Clemente.
Thank you, Madam Chair. I would like to move items 1 through 5 for receive and file and items 6 through 13 for approval.
Moved by Commissioner Clemente, supported by Commissioner Garza. Discussion, Commissioner Kinlock.
Madam Chair, I would like to, at your prerogative, exercise that right to go into closed session as relates to item number 13.
We don't do closed session for a board meeting, but I will ask our counsel for direction. Use us. I don't know if there's some question, Commissioner, that you could ask offline. Otherwise, we would have to move upstairs to have closed session and come back down.
I'll ask out offline.
Thank you. Commissioner Kenizik,
Thank you, Madam Chair. I'd like to abstain on item 13.
stay on item 13. Okay. And if there is discussion that can be had on 13 through Corp Counsel, if you could do that at this time.
Good morning, through the chair, Sue Hamud, Deputy Corporation Counsel. Obviously, there are not, if there was a specific general question that you have, Commissioner, I'm happy to address it, but if there's anything pertinent to the litigation,
It's pertinent and I can ask offline.
Okay.
Yeah. Mhm.
Thank you. Any additional discussion or questions on government operations report? Hearing none, please vote. And the two abstentions, are those to the whole report or particular items? 13, okay. So,
Duly noted.
you know the abstentions,
The
okay.
abstentions of Commissioner Baker McCormick and Commissioner Kenizik on item number 13 only.
Thank you. Next item, please.
We are on page 19 of the agenda, upcoming meetings.
All right, please note the upcoming meetings for next week. Again, the schedule for the budget hearings will be coming out soon. Mr. Adams, do you want to address the meeting schedule for budget hearings?
Yes, through the chair. We're just waiting on the dates and locations of our off-site meeting before we release the budget schedule.
And hopefully that'll be included by the end of this week.
That's what we're planning.
Thank you. Please note the meetings for next week. If there are any changes to the meetings, please let the clerk know so she can let the members of those committees know as well. Next item.
We're moving to new business. There are immediate consideration. There are 2 items listed on the agenda and 1 on the addenda. Item number 1 is requesting commission approval of the reappointments of David Katz, Commissioner Alicia Bell, and Commissioner Terry Marecki to the Wayne County Zoological Authority Board of Directors.
That's pretty self-explanatory. It's been moved by Commissioner Peterson Mayberry, supported by Commissioner Kinlock. Any discussion to the motion to reappoint the members to the Wayne County Zoological Authority? Hearing none, please vote. Next item.
Commissioner Clemente. Motion carries. We're on item number 2, requesting commission approval of the recommended 2-year comprehensive executive budget and appropriation ordinance for fiscal years 25-26 and 26-27. This item is on the agenda for introduction and referral to the Committee on Ways and Means.
Moved by Commissioner Kinlock, supported by Commissioner Garza. Again, this is referring the budget to the Ways and Means Committee. Any discussion? Please vote.
Motion carries.
And then the addenda.
Item number 3 is requesting commission approval of a retroactive 22-month addendum to a cooperative contract between the Charter County of Wayne and Thompson Reuters doing business as West Publishing Corporation, not to exceed $324,942.20 to provide online legal research through its Westlaw database for the prosecutor's office.
Mr. Tony.
Of the committee. Thank you. I'm Tony Guerrero. I'm the Chief of Legislation, Grants, and Community Relations for Wayne County Prosecutor Kim Worthy. This matter, first of all, I have to say thank you to the commission staff and to all who worked hard to get this before you today. I'm not making any excuses, but I just want to make certain that the commission understands the backstory. We at the prosecutor's office had submitted this request 3 months ago. Unfortunately, we found out very late that instead of going into the commission queue, it wound up going into a queue where it was waiting for signature and no one knew it was there. That's the main reason we bring it forward to you at this point in time. Westlaw, under West Publishing, Thomson Reuters, is the legal search engine for the prosecutor's office and other attorneys working for the county. It is a superior product. It's unmatched. This came about because of an RFP that we did about 5 years ago. In any event, the reason for the immediate consideration is not only what occurred and put this behind, but also the fact that had we not brought this before the commission today, we ran some very serious risks. Number one, we could be held in default by Thomson Reuters and shut down our system. They could also just cut us off as far as our legal research and writing. I'll be happy to answer any other questions, and I apologize. My phone keeps going off.
Busy man. Any questions on this item? Yeah, we literally received it on Monday. So let me thank staff for moving quickly to get this before us on today.
Madam Chair, they were phenomenal.
They always are. Thank you. And here we have it. So are there any questions on the item itself? And again, it's for the tools that our lawyers need in the prosecutor's office to do their work. Thank you, Tony.
Thank you.
It's been moved by Commissioner Garza, supported by Terry Marecki. Any discussion on this item? Hearing none, please vote.
Motion carries.
Let me add a caveat. We did this one time, but we're not going to make a habit of getting things on Monday and having them on Thursday. And that goes broadly to everyone. Thank you. Next item, please.
We're on page 21 of the agenda. Item B, testimonial resolutions and certificates of appreciation. There are 4 items listed.
Okay, we have 4 items. Celebrating hockey team, celebrating grant manager Kimberly Dorsey, celebrating Darlene Leaks, and Jesse Francisco. Discussion, Commissioner Baker McCormick.
Thank you, Madam Chair. I just wanted to acknowledge Darlene Leaks, a good friend of mine. And when I worked full-time in real estate, she was a mortgage rep at Flagstar, and she's been there a very long time doing good work, and she's retiring. So I wanted to acknowledge her on her special day. Also, Kimberly Dorsey, she worked for the commission for some time, but now is the fiscal grant manager for Indigent Defense. And I wanted to acknowledge her because she's not only a standout citizen, but she also lives in my district and has done a lot of good work in the North Rosedale community. So I wanted to wish her a very, very happy 50th birthday. And I know she's probably on the line. I'm hoping, I know she wasn't feeling well today. And I want to make sure that you know I am wishing you well, happy birthday, and hope you get well soon.
Thank you, Commissioner, and congratulations to those two young ladies on these major accomplishments. Commissioner Allen Wilson.
Thank you, Madam Chair. I just wanted to commend Commissioner Dobb. I'm looking at the resolution for Plymouth Flyers Black Hockey Team, leading their team to victory in the 2025 USA Hockey National Championship. This is definitely an amazing accomplishment because, as we all know, hockey has not been exactly known for minorities. So I know when I was a little kid growing up, I used to play hockey in the basement, and I always slammed the puck up against the furnace, and my dad would get ticked off. And so it's a sport that I truly enjoy and I truly appreciate. And I want to just say again, I want to thank you, Commissioner Dobb, for honoring these individuals because, again, this is something that's not customarily associated with minorities. So good job, Commissioner. Thank you.
Thank you. Thank you, Commissioner. Commissioner Dobb?
Thank you for that, Commissioner Wilson. I will say it is, the black team is just their color of
Oh,
the
shoot.
team. So I just want to clarify that. but,
Holy cow. I wish somebody would have told me the black hockey team. Okay. Okay. I know it sounds kind of too good to be true, but anyway, I just thought I would. Madam Chair, you should have told me about that now.
We'll edit that part out, Commissioner Wilson. We'll edit the,
Well, still, thank you, Commissioner Dobb.
Thank you for that clarification,
Holy
Commissioner
cow.
Dobb.
Need to get another name for that team, I guess. My goodness. Okay. Okay.
Thank you. Thank you so much. I've been moved by Commissioner Baker McCormick. I don't know, I should have some Commissioner Wilson supported, but supported by Commissioner Bethune. Any further discussion?
I just want to thank her for clearing it up.
Yeah. Thank you.
Not minorities. We are black, but we're
Yes.
not minority.
Thank you. Oh, please vote.
Oh, those are, okay, thank you. All right.
Lord. That was funny. Oh, gosh, that was funny.
What?
Commissioner Wilson, please vote.
Oh, I'm sorry.
Or not, I don't know.
Oh, boy. All right.
Thank you.
Somebody
Next
find me. I'm
item,
sorry.
please.
We are on memoriams. There are 8 names listed.
Oh, my goodness gracious. I have one correction on the memoriams on item number 1. The last name should be added, Livingston after DeTigue. It's a long name, but the last name is Livingston. So Laura Veronica Marie DeTigue Livingston. We can make that note correction for the record.
Noted.
Any additional names to be added to memoriams today? Commissioner Scott?
No additional names, but I would just like to say that Vera Rosetta McFarland Wilson was 101 years old and was a very active person in the community. She was in that area by Davison and all of us who kind of grew up in that area.
Oh, nice, nice.
We
101.
thank God for her life and all that she was able to do in the community.
Amen. Thank you. Thank you, Commissioner. Commissioner Garza?
Thank you, Madam Chair. I'd like to add the name of Devin Shinever to the list as well. He's a young man, 25 years old, passed away in Brownstown Township. His family, the Shinever family, the Hall family, been big fixtures of the Taylor community and Brownstown Township community for many years. A long line of public servants from both families, and I want to recognize him. And also, he's a former member of the Army National Guard, extraordinary young man who passed away very young. So I want to add him to the list as well. Thank you, Madam Chair.
Thank you. Keep their family in our prayers. Thank you so much. And I'll add this, but it'll be printed at the next full board meeting. But last year, I believe it was, some of you may have seen on the news, the 100-year-old twins They're my husband's cousins. One of them passed away earlier this year. And as it goes, the second one, twin, passed away last week. She made it to 101. The first twin made it to 100, and the birthday came between them. So we'll be having the services next week. But they lived a very full life, and they were always together, and now they're together again. So keep the family in your prayers as we move through this difficult time. Thank you. Any additional names? Okay, if everyone could please stand for a moment of silence. Thank you. Next item, please.
Public comments.
Okay, do we have anyone on Zoom? Did we get the Zoom rectified with any Zoom? The Zoom did not take today. Okay, Zoom is working. No hands on Zoom. Any emails?
No emails were received.
No emails. Public comments in the chambers?
Do have one card. Ms. A. Lynn Bose Dukes.
Okay, 2 minutes. Thank you. Good morning.
Good morning and thank you. I am on. Good. I am back again and I am from American Heart Association. Obviously, I've spent time with several of you. Am back, however, to offer condolences. Had not been able to get back since Irma Clark Coleman passed. We miss her terribly as we are still fighting the battle at Wayne County Airport Authority and the idea of a proposed cigar lounge. So we are thankful for your new appointment of Commissioner Palomara. I'm looking forward to spending some time and bringing you up to speed. We just did a poll that released last month and said that 77% of those voters that were polled oppose, and 60% of that strongly oppose a cigar lounge at the airport. The airport did actually their own customer satisfaction survey, and it came back 87% of travelers would like to be in a smoke-free environment. So for the life of me and my cohorts, we cannot figure out why they continue to go forward. Our ask today is that you have some conversations with your friends and with your cohorts over at the board and ask, why are we even entertaining this? It would endanger everyone that is exposed to this secondhand smoke. We know how dangerous it is. So again, we're back. We're saying thank you always for being so supportive of our efforts to keep our community healthy and safe. And we're asking you and alerting you to let you know that this fight is still at hand and we'd like to shut it down so that the RFP does not include a cigar lounge. Thank you.
Thank you so much. Thank you for being here today. Look forward to your continued advocacy.
Yes.
And if there's anyone that needs additional information about the American Heart Association, this is our liaison to
Yes.
anything and everything you need to know about how we can all be heart safe. So thank you for coming down today, and you'll probably stick around for a little bit after the meeting.
I will.
Okay,
I will.
thank you. I
Thank
appreciate
you.
you. Thank you so much. Any additional cards?
No additional cards.
Okay, public comments one more time. Okay, thank you. Next item.
Reconsiderations.
There are none.
Remarks by members.
We have a very special day coming up on August 24th. I think we know what day that is. It's Commissioner Marecki's birthday. So we want to say happy early birthday, Commissioner Marecki. She'll be having a big 35th birthday party in her office, so please come up and eat cake. She'll be providing that as we celebrate her birthday. So thank you, Commissioner Marecki, and happy early birthday. Any remarks by members? Commissioner Wilson.
Yeah, thank you, Madam Chair. Just briefly, I just want to say this has been a very obviously spirited discussion that we've had today as far as the medical debt initiative. I had an opportunity to talk to Dr. El Sayed the other day. He was out at the Wayne Disposable meeting that we had out in Van Buren, where they're trying to dump a bunch of toxic waste into the community through Wayne Disposable. And he got up and spoke against this, obviously. But afterwards, I talked to him about this because this was his initiative, I understand. He was the one who sort of spearheaded it. And there is a lot of, I must say, controversy about this medical debt relief process. I have an awful lot of citizens in my community who have raised issues and questions about this. So I say that to say this. This has been very good because it's very explanatory. People who are looking online, it's been publicized what this process is really all about. Myself as a commissioner, I like to be abreast and privy to everything that's going on within the chambers and within the commission staff. So it's helpful to me to see Director Keneal Johnson get up and enunciate on this initiative. Having said that, all of the things that they talked about today under the Health and Human Services Committee, things that we talked about last week, it's good that we promulgate this to our citizens in the county, because oftentimes people don't know. They don't have enough information in terms of all the good things that we're doing here as a commission. So I say there's a lot of doom and gloom, obviously, with what's going on in Washington, D.C. and across our country, but we have a lot of positive things that are going on here in Wayne County, and it's being spearheaded by some very, very good leadership. So again, at the end of the day, we need to be more, I think, proactive and more overreaching or overarching, if you will, when we explain the things that we're doing that's to the good of our citizens in Wayne County. So I close by saying the issue out in Wayne County, Van Buren, is very, very detestable. The Judge Cox ruled a couple of weeks ago that the toxic waste would not be coming to Van Buren, Wayne Disposable waste site, if you will. But yet, now they're trying to expand. So that wasn't good enough for them, that the judge ruled against this toxic waste coming. Now they're trying to expand by 23% horizontally the waste dump. So, and in addition, they're trying to seek opportunities to bring more hazardous and radioactive waste material. So the judge ruled that T-norm, which is technologically enhanced, naturally occurring radioactive material, that can't come, but they didn't rule out other radioactive waste coming to Van Buren. So it's a very, very tough situation. I want to thank Executive Evans, who was there the other day, who spoke very eloquently about resisting this attempt by Wayne Disposable and our own EGLE, the Michigan Environmental Protection Agency, that's supposed to protect our lakes and our citizens. They're giving permits like you give out candy in a nursery. And it's absolutely ridiculous that they continue to do so, rubber stamping these corporations' ability to proceed for after profit versus protecting the health and welfare of our citizens. So thank you all for listening, but we do have a lot of issues out there, and we need to make sure that we continue to stand strong and represent the citizens, which is why we're in office today. So thank you all for listening to me. I appreciate it, and God bless.
Thank you, Commissioner. Appreciate
Thank
that.
you.
Thank you for being at that very important press conference to discuss this and to resist and push back. And as a body, we will continue to do so as well. Thank you.
Thank you.
Okay, any additional remarks by members? Okay. Is there a motion to adjourn?
So moved.
All right. Thank you so much. Meeting adjourned. Thank you.